Oregon's 2024 legislative session starts in less than a month, and lawmakers are now getting ready with their bills. Today, House Republicans introduced a bill to bring back criminal penalties for drug use, essentially undoing big parts of Measure 110. Here are some of the bullet points. They want to make possession of drugs like fentanyl, heroin, and meth a Class A misdemeanor. People would be given the choice of treatment or jail time. It also bans public use of drugs and requires prison sentences for drug dealers and manufacturers. You kind of probably, if you paid attention, know what it's like for Oregon Republicans. Not great. Their bill isn't likely to succeed on its own, but there are likely to be some big changes in that law regardless. A bipartisan committee of lawmakers has been meeting over the last several months to hear from law enforcement, jails, courts, along with people working in drug treatment and prevention. Yesterday, they introduced 3 committee bills that will deal with addiction crisis, behavioral health, and public safety. The language of the bills has not been released yet. They also heard from the state's Alcohol Drug Policy Commission, which presented a 14-part list of recommendations for lawmakers on Measure 110. It had things like improving prevention infrastructure, increasing access to medications like methadone, recovering housing, and harm reduction like Narcan. Meanwhile, the Oregon Health Authority says the funding side of Measure 110 is finally starting to bear some fruit. Their data shows that behavioral health resource network providers reported a nearly 300% increase in people seeking services from July of 2022 to June of 2023. They set up a data dashboard where you can see where the Measure 110 money is going to providers across the state and how much has been spent. In Multnomah County, for example, millions of dollars have gone into peer support services and housing, but a lot less into substance use disorder treatment and supported employment. And only 38% of the money allocated to providers has been spent. We asked for your thoughts when it comes to Measure 110. Lawley told us the state needs to put more money into opening more drug treatment and alcohol treatment centers. Unfortunately, jails are still doing things these drug and alcohol treatment centers should be doing. And another viewer wrote, should not go backwards into criminalizing 110, force the people into treatment. One of the suggestions that came up during the Joint Committee meeting was having a person act as a drug prevention czar to coordinate all the different agencies working on the drug crisis across the state. The idea was pretty enthusiastically received during the meeting, but viewer Lois has some reservations. Based on the inertia and non-accountability of our current government, she writes, a drug czar to coordinate the state's drug crisis response seems like just another bureaucratic layer of inaction. We also got an email from someone who says they're in recovery now and that they know what drug users need. Mark wrote, I'm 4 years, 10 months clean. We need detox places and a lot more inpatient services. We need to put peer support in there, people that have gone through the journey of recovery. We also need transitional housing. I'm a firm believer that we do not need to lock addicts up. We need to help these people, and we need to seriously invest in mental health services. But several people told us they did not want the state to invest in prevention. They want parents to do more to keep kids from using drugs. Vicky wrote to say, please do not try to foist parenting onto the state. Difficult situation, but parents need to accept some responsibility. A lot of great comments last night. Thanks for that. Please let us know what you think about Measure 110 or any of the topics we talked about tonight or anything else you're curious about. Send us an email, will you? The address is thestory@kgw.com. Or you can call and leave a voicemail. The number is 503-226-5090. That all gets through even if there's snow and ice falling outside.